Alright, good morning, Saturday morning, welcome to Athlete Fix, and today we're going through 3 potential reasons why you may get that pinching pain at the front of the hip when you're squatting. That's coming up next. Okay, so reason number 1 is having that aggressive anterior pelvic tilt as you go into your squat. And what do we mean by anterior pelvic tilt? Well, if you imagine your pelvis is almost like a bowl or a sink full to the brim with water, and as it starts to rotate forward to the point where that water would spill out the front. So it's not to say that if you just have an anterior pelvic tilt or slightly rolled forward pelvis, it doesn't guarantee that you're going to get hip impingement or not be able to perform a full depth squat, but so just show that there's an absolute impact of both increasing your likelihood of impingement as if you have an anterior pelvic tilt going forward, and a reduction in the available range of motion in the hip, both going into flexion and into rotation. And all you need to know on that is that these are the two movements absolutely imperative to allow you to perform a full depth squat. So if you think of it like this, the acetabulum, or the socket of the hip joint, is a projectional part of the pelvis, and your femur, or the femoral head, or the ball in this case, as that pelvis starts to roll forward, you can see how the top of it, the top part of that socket, starts to encroach, like an overhanging roof, preventing the amount of available range of motion for that hip to come through in the squat, as in this position here, and making it more likely for you to smack the top of it and get that impingement, that hip pain feeling at the bottom. So the most important thing is, if you're someone who we're watching you doing a squat, and as you sit down you start to get that aggressive rib flare and your lower back really starts to arch out and your pelvis rolls forward, that this may well be the case that's causing your hip impingement at the bottom, or struggling to get that full depth. So important thing is to make sure that you have sufficient anterior core control, pelvic control throughout your range of motion in the squat. And there's lots of different exercises you can do for that, planks and things like that, rollouts, etc., which we'll go through in another video. But reason number 1 is make sure you've got control of your pelvis, preventing the anterior pelvic tilt as you go down to your squat. Okay, so reason number 2 is something called femoral anterior glide syndrome. And don't worry, I know it's quite a mouthful. This is a term coined by Shirley Salmon, a therapist. And effectively what we're talking about is we go back to that visualization of the socket, in the hip, the femur here. The anterior glide, it's almost as if that ball and socket joint is being yanked forward as you ascend, as you extend your hip out of the bottom of the squat. And there's 2 things that could potentially cause this. One is potentially overactive hip flexors, like your TF out the front, yanking it forward. But equally, the other important thing to highlight here is that of the 2 main hip extensors that you have, your hamstrings, which attach from the bottom of your pelvis and that ischial tuberosity and down onto the tibia, they have this effect where they don't have particularly good control of keeping the ball within the socket. So effectively what can happen is if you have a sort of pure hamstring hip extension pattern, it can often lead to exacerbating this flying forward of the ball in the socket. Now conversely, the glutes, hamstrings being 2 joint muscle really, and glutes being a 1 joint muscle, which just come from the pelvis right onto the proximal, the top end part of your femur. The glutes are in a much better fit position to be able to have that more precise control of locating and anchoring the ball into the center of the socket as you extend the hip. So this is just telling you basically that, 1, you need to make sure you're addressing any overactive hip flexors at the front. 2, though, hamstrings can often become dominant and take over the show in the presence of an underactive glute, and then leads this syndrome. So especially if you feel this hip impingement as you're coming out of the squat, this may well be the conundrum that you're in. So it's important, and you may well benefit from doing isolated glute activation whilst preventing your hamstring from jumping in, before translating that into a more functional exercise and correcting your movement pattern as a whole. Okay, so reason number 3 is a potential tight posterior hip capsule. And a hip capsule is essentially just a ball of connective ligamentous tissue that surrounds the joint, the hip joint in this case. And if we go back to that visualization again that we used before, just so you can kind of see what's going down, sometimes I use this kind of comparison with like a tube of toothpaste. So if you imagine, when you squeeze one end of the tube, the toothpaste starts to shoot out the other end. If you think of this as the back of your hip capsule, and it starts to close off and get tight and squeeze up here, you can start to force that ball further forward in the socket. So then its axis of rotation is going to be slightly ahead of where it should be rather than the center. So that as you rotate, as you start to descend into that squat and the hip flexes, again, leads to the same eventuality that you're more likely to impinge and subsequently reduce your range of motion. So what can you do about that? Well, there's a posterior hip self-mobilization exercise that you can check out here. I've got a video of that. And honestly, if this is genuinely the case that's causing you to have your hip impingement, I've both used it myself and with clients, and you can get very immediate relief of that hip impingement sensation instantaneously. Obviously, it only works if that is genuinely the cause. As you've seen from the other two reasons, there's not just one particular thing when it comes to hip impingement, but there's a great one to try out. So there you have it, 3 reasons for hip impingement during the squat. Guys, I hope you found this video useful, and if you have any comments, questions or suggestions for future videos, please feel free to leave them in the comment section below, or on our Facebook page, facebook.com/athletefix. You can also follow me on Instagram, it's JG Physio Coach, and on Twitter, AthleteFix. Have a great day, speak to you next week, and don't forget our Monday night live Facebook chats on my personal page. It's Monday at 8:30. We have a different topic every week. Hope you can join us there. Okay guys, till next time.